Okay, here we are. I'm so excited.
I am too.
Let's get started with these pelvic floor exercises. So what should I do
Great.
first?
So the first one, we're going to use a stability ball, and you're going to sit on top of the ball,
Which way?
facing this way, and you're going to have your feet about hip distance apart, feet pointing straight ahead, and knees over the ankles.
Okay.
Okay, and
So
then
like that?
exactly. And then what you're going to do here is about 4 fingers below the belly button. You're going to kind of pull it in and up, and think about relaxing the tailbone so it just drops straight down.
Okay.
And then in between the breasts, with the breastbone in the back, you're going to lift up.
Oh.
And then lengthen through the top of the head. So you want to keep that posture throughout these exercises.
Ooh. Okay.
Then the more you lift up, you just feel the abs come in and you kind of lift up off of the ball. So the abs drop in, but the tailbone drops, and then you want to stay lifted here.
Because I was kind of collapsing.
Yes, so a lot of people, when they kind of pull in here, and when they move, they'll kind of collapse forward. So I'll kind of walk you through that.
So is it helpful to think about putting your shoulder blades back,
No,
or is that not the kind of
It's not the
upward
kind of
movement?
upward. It's
Okay.
in
So it's,
here.
it's
So
really right here
Yeah,
first. You're
the
gonna tuck
low
the
abs
tailbone.
come in, the tailbone goes straight down. So we're not tucking it forward, it just goes straight down. So the low back relaxes.
Oh.
Then we're lifting our torso straight up and lengthening through the top of the head. So that is perfect.
Oh.
So what we're going to do from here is we're going to do a pelvic tilt. You're going to tilt your pubic bone to your spine, and then relax, and it just kind of rebounds back.
Oh,
So you'll tilt the pubic bone to the spine, and then relax, and the pubic bone rebounds back towards the ball.
So you know what? Okay, so I feel this in so many places, and I wonder if that's normal or if I'm not doing it right. So I feel it in the tops of my thighs. I feel my feet moving when I'm tilting, and then I'm noticing a little bit of movement like between my shoulders.
Yes, so let's go through that. You can also go up onto your toes. So you can go up onto the toes. And that for you with this ball is a great position. So depending on, so if you go back down here, there's a little bit more bend than I would like. So I would have you come up here.
Okay.
So now when you tilt the pubic bone to the spine, a lot of people kind of collapse when they do that. So you really need to stay lifted, which is very difficult at first.
It is.
So pubic bone to the spine, and then you'll release it and relax, and now it goes this way. So you are moving the torso, but you don't want to. You want to stay really lifted here.
Okay.
And oftentimes, when we tilt our pubic bone to the spine, so you're kind of making a compensation in your torso. Well, most people, not always, but often are very restricted back here. Their lower backs are really tight, the rear portion of the pelvic floor is tight, so they don't have a lot of mobility to move their hips a lot. So I like quality over quantity. I would rather have you have less movement of your hips but have appropriate movement than move your hips this way but just compensating a whole bunch, if that makes sense. So as you do the exercises, we're going to restore more elasticity in the pelvic floor. So when you tilt your pubic bone to the spine, it's like that front portion contracts, and then when you release it, it's eccentrically loading and rebounding back. Yes.
So here I'm bringing it forward. When my shoulders came forward again, we really have to practice on kind of holding this all
And when you
upright.
really have a nice torso lift and lift through here, the shoulders just fall into place, so we don't even have to think about bringing them back.
Okay.
I don't like thinking about bringing the shoulders back. People often overcorrect and they kind of arch their back.
Okay.
So those are why they say feet straight ahead, low abs in. Yeah.
Tailbone left. Lifting, but lifting without arching.
Lifting through here to the spine, straight up. Nice. And then just kind of tilting your pubic bone to the spine. And then relax. Yeah. Yes.
Oh, this is intense.
Yes, it is so much harder than it looks when you do it correctly.
It really is. Oh my gosh. Okay. Yeah, I'm still feeling it a lot right here.
You are gripping, a lot is working. So pelvic floor is not just your pelvic floor working, it's really a full body workout through the whole program.
I can tell. Oh my gosh. And my whole core is engaged.
Yes. And the more you use that lift, Dr. Kate, and reach up high, the more the abs really pull in, and your abs are working so hard here.
Can you tell I sit a lot for work?
So that's why you have a little bit more restriction in the pelvic tilt. So sitting does make your pelvic floor really tight and rigid, and people who sit a lot or are tighter in the pelvic floor don't have quite as much mobility. But it doesn't shift. It does shift.
Yeah.
So it just takes a little bit of time, but it gets so much better.
I mean, already I can feel just a little bit more like intention and focus in those muscle groups.
You also can do it with your legs out wider.
Okay.
Like that.
Like this? Okay.
So you can do it from there and then just do the same thing.
Now what is the difference between
And try to not have the knees move forward and back. You want the knees to stay fairly still.
You know what's interesting? Just now I noticed my sit bones were kind of wonky. Like I was not sitting on them right. So I think just kind of like.
So you like this position. For some people this is uncomfortable and some people prefer one over the other. It kind of depends what's going on with someone's body. These are fantastic for pregnant women.
I would imagine.
Feels amazing to like just the pelvic floor, relax the back. And if I'm doing a lot of office work and computer work, I'll get up and I'll just do a few of these and really with the intention of the pelvic floor and then also the lower back and really relaxing the lower back.
I mean, that makes so much sense. So this to me feels really rooted. It feels really grounded. I can feel my sits bones, which is helpful in terms of stability and also an emotional sense of connectedness to everything.
Yes.
Before, when my legs were more forward, I felt a little wobbly on the sides, which took my attention away from being able to move, you know, the isolated parts of my body that we're working on. So let me see if I can get this posture right and see if I remember. Okay.
Perfect.
So I'm on my sits bones, and I want to 4 fingers down from the belly button, right?
Yeah.
Kind of like just tuck this in.
Pull it in.
Pull it in.
I don't like tuck because then people will overcorrect.
Yes,
and then,
I do that. So, okay.
So draw
So
it in.
we want to almost imagine like there's a string from like 4 fingers down from the belly button kind of pulling up and down.
Exactly.
Okay, good.
And then that tailbone just goes straight down, the back is relaxed. We're lifting through here, to the top of the head, and then you'll just do the pubic bone to the tailbone, and then relax the axle, you just let it release.
Oh yeah, that feels so much more stable this way for me.
And you can do both. I change it up at home a lot, and I'll do some with straight ahead, some feet turned out, some with my feet flat, some up on my toes. And this is one with pregnancy again, it just feels incredible. And men can do this one, it's fantastic for men.
What does it help men do?
With their pelvic floor as well, and their hips and their mobility.
And that would help them with incontinence? Does it impact
prostate is a big thing with pelvic floor with men. So men with like prostate or prostate issues and pain because their pelvic floor surrounds the prostate.
Interesting. Okay, that's really great. So I just got a little wobbly there because I started talking and stopped focusing.
Yes, easy to do. And you really have to be mindful when you do pelvic floor work. You can't be watching TV not thinking about your pelvic floor. We really want to strengthen that connection and get that turned on.
Right.
You have to do it mindfully. Turn the TV off, go in a separate room from your kids and just take a little time to focus on you.
Well, I love that idea too because it really puts an emphasis on reconnecting with your sexual energy, with your idea of being embodied and really staying present. And you know, I'm all about the multitask, Courtney, but even when I'm at the gym, I'm watching TV or listening to music or eating. But I feel like this is more like a yoga practice in the sense that the more embodied you can be, the more quickly you're going to be able to develop that felt sense of connection, which is equally as important when we're talking about orgasmic potential.
And then when we're talking about orgasm, this move is actually a fantastic one for women to do when they're on top. So it really helps with internal orgasm. So this move, and the more mobility you have, the more you're able to move, and the more hip movement you have on your partner, the better for you and for them.
Yes, I can see how this one is really beneficial.
Yes.
Okay, great. So how many sets of this should someone do? Or?
So you can do 2 or 3 minutes of it, or a minute. I don't love telling people do it for X amount of minutes or times because I prefer great form. So as soon as someone's form goes away where they maybe can't maintain a good posture, they can't keep their abs in, and their body's just fatigued, you move on to the next exercise or you stop that one because we're putting good movement patterns in your body and helping correct things. So what we do is continue to put poor movement patterns in our body, we're not going to correct and move better.
Yeah, okay, that makes so much sense.
And also really getting in tune with your body and feeling it and knowing when enough is enough. Some days it might be 1 minute, some days it might be 3 minutes, but really listening and honoring your body when it tells you something.
And what a great way to practice being interoceptive, so understanding the cues your body is giving you, and then being able to communicate that with your partner, because when you have that vocabulary established, then your sex life can become so much more intense.
Yes.
Right?
Absolutely.
Yes. No more like performative or, obligatory sex. Where
Yes.
you can find your voice in that way.
Absolutely.
Great. Okay, cool.